Hello everyone, and welcome to this comprehensive report on adrenaline, also widely known as epinephrine. My name is Docsaab, and today we will be exploring the critical role this powerful hormone and medication plays, particularly in emergency medicine. We will cover its fundamental properties, mechanism of action, key medical uses, and essential administration guidelines. Let's begin by exploring the fundamental chemical makeup and pharmacological properties of this vital substance. Adrenaline is a naturally occurring catecholamine hormone and neurotransmitter primarily synthesized and released by our adrenal glands. Its chemical structure is quite precise, derived from the amino acids tyrosine and phenylalanine with a molecular formula of C9H13NO3. Historically, it was first isolated in 1897 and then artificially synthesized in 1904. You will hear it referred to by two main names, adrenaline, which comes from Latin, and epinephrine from Greek. Both terms literally translate to on the kidney. Pharmacologically, it is classified as a non-selective adrenergic agonist. This means it stimulates multiple types of adrenergic receptors found throughout the body, which directly accounts for its wide ranging and powerful physiological effects. Now, let's dive into how adrenaline actually works, specifically its role in triggering the well known fight or flight response. Adrenaline exerts its effects primarily through its interaction with both alpha or and beta adrenergic receptors. These receptors are located on cells throughout nearly every system in our body. Our bodies naturally release adrenaline during moments of intense stress, preparing us instantly for immediate action or escape. When administered as a medication, it produces these some powerful and rapid physiological changes. On the beta receptors, adrenaline causes bronchodilation, essentially opening up our airways, and it increases both the rate and force of our heart's contractions, thereby improving cardiac output. Simultaneously, its action on alpha receptor causes vasoconstriction, which is the narrowing of blood vessels. This particular effect is absolutely crucial for reversing severe low blood pressure and reducing swelling, especially during an anaphylactic reaction. It also efficiently redirects blood flow to vital organs like the brain and muscles. These combined action dramatically increase blood pressure, expand airways, and elevate blood glucose levels by stimulating the breakdown of glycogen, providing a quick burst of energy for the body's immediate needs. Adrenaline injection is without exaggeration a life-saving medication used across several critical medical conditions. Its primary and arguably most vital indication is in the treatment of anaphylaxis, a severe, rapidly progressing, and potentially fatal allergic reaction. Adrenaline is the only medication that can rapidly reverse all severe symptoms of anaphylaxis by opening airways, maintaining blood pressure, and reducing swelling. Medical guidelines strongly recommended its prompt administration at the very first sign of severe allergic reaction. Beyond anaphylaxis, it's a key component in advanced cardiac life support protocols for cardiac arrest, where it's used to help restart the heart and improve coronary perfusion during CPR. Additionally, adrenaline has other significant uses. It helps increase blood pressure in patients experiencing hypotension associated with septic shock. It can improve symptoms of croup in children, and it's even used in combination with local anesthetics to constrict blood vessels at the procedure site, thereby prolonging the anesthetic effect and reducing bleeding. The method used to administer adrenaline is critically important and depends entirely on the clinical situation, as each route has different speed of absorption and onset of action. For anaphylaxis, the intramuscular injection is the preferred route, typically given into the large muscles of the anterolateral thigh. These methods allows for rapid absorption and has an excellent safety profile. Auto-injectors like the EpiPen are specifically designed for easy IM administration by patients or caregivers. In a hospital setting, particularly during cardiac arrest or for profound shock unresponsive to other treatments, adrenaline is given intravenously. This route provides the most rapid effect but carries a higher risk of cardiovascular side effects and must always be given by trained professionals. If IV access cannot be established quickly during an emergency, adrenaline can be injected intraosseously directly into the bone marrow. This route is considered therapeutically equivalent to IV route for emergency drug delivery. Less common routes include subcutaneous or via an endotracheal tube if no other access is available, though their absorption can be less reliable. Newer formulations like nasal sprays are also becoming available. Accurate dosages and concentrations are absolutely paramount when administering adrenaline. Dosages are highly specific and depend on the condition being treated, the patient's age and weight, and the chosen route of administration. To prevent dangerous medication errors, the FDA is transitioning away from traditional ratio expression such as 1 is to 1000 in favor of clearer mass per volume units like 1 milligram per milliliter. As you can see, for anaphylaxis, adults typically receive zero point 0.3 to zero point 0.5 milligrams IM and pediatric patient receives zero point zero 0.01 milligrams per kilogram with a maximum of zero point 0.5 milligrams, both using a 1 milligram per milliliter concentration. In cardiac arrest, adults receive 1 milligram every 3 to 5 minutes IV or IO and pediatric patient receive zero point zero 0.01 milligrams per kg every 3 to 5 minutes, both using a zero point 0.1 milligram per milliliter concentration. It's a critical note that the 1 milligram per milliliter or 1 in 1000 solution must never be used for IV injection unless it has been first diluted by healthcare professional to the zero point 0.1 milligram per milliliter or 1 in 10,000 concentration. Administering the concentrated form intravenously can be fatal. While adrenaline is undoubtedly a life saving drug, it is potent and comes with potential side effects. Common side effects often include anxiety, restlessness, tremors, headache, palpitation, a racing heart sensation, sweating, dizziness, and nausea. These effects are generally temporary and simply reflect the drug's powerful stimulation of the nervous system. Serious side effects, though rare, can occur especially with IV administration. These include dangerously high blood pressure or hypertension, cardiac arrhythmias or irregular heartbeats, myocardial ischemia or reduced blood flow to the heart muscles, and pulmonary edema, which is fluid in the lungs. Regarding contraindications in life-threatening anaphylactic emergency, there are no absolute contraindications to using adrenaline. The profound risk of not treating anaphylaxis far outweighs any potential risk associated with the medication itself. However, certain precautions are necessary. Caution is advised for individuals with pre existing conditions such as heart disease, high blood pressure, hyperthyroidism, diabetes, and Parkinson's disease, as adrenaline can potentially worsen these conditions. Crucially, injection should never be administered into digits like finger or toes, nor into the hands or feet, as the powerful vasoconstriction can cut off blood supply and cause tissue necrosis or death. Finally, after any use of adrenaline autoinjector, immediate emergency medical attention is always required. Thank you guys for your attention. If you have any further questions, please feel free to reach out and please like, share, and subscribe to the Docsaab's Diary. Thank you so much, guys.